All right, welcome everyone. Thanks very much for joining us again this week for another Facebook Live conversation. Today we are joined by several folks to have a very important conversation as part of Pride Month. Happy Pride Month, everyone. A very important conversation about health and wellness for the LGBTQ community. So today we are joined by Shane Scott, who is training manager at True Colors, as well as a private practitioner in West Hartford, and Casey Harding Wheeler, who is the Center for Key Populations Director at Community Health Center Incorporated in Middletown. And leading the discussion on behalf of CCADV, we have Wanda Gaines, who is our Director of Diversity and Accessibility, and Ashley Starr-Frechette, who is our Director of Health Professional Outreach. I'm just gonna throw it over to Robin real quick just to do some quick housekeeping with folks.
Hi, good afternoon. Thank you, Liza, and thank you everyone for joining us this afternoon. Just a few things before we get started. Today we are broadcasting our webinar on Zoom as well as Facebook Live. So if you have any questions for our panelists at any point, if you're on the Zoom call, please feel free to put them in the chat bar on the right of your screen, or if you're on Facebook Live, just put them in just type them in and into the comment section, and we will field them as we go. And if you have any questions after that, please feel free. There's a button that you can raise your hand as well, and I'll be keeping an eye on this and moderating it as we go. Thank you for joining us today.
Great. Well, thank you both and for all of you for joining us. We really appreciate it. We're really excited to learn a lot more about both of the programs that you both represent. So before we started, I just wanted to learn a little bit more about the organizations that you guys are both coming from. So Casey, I was wondering if you could please tell us about the mission of Community Health Center and the Center of Key Populations.
Sure, thank you. And I have to say, I love Wanda's title. That's a great title. So at CHC, we have 15 brick and mortar sites across Connecticut, and we really believe that healthcare is a right and not a privilege. And so to that end, we really work hard to eliminate any barrier that would hinder a patient from being able to access whatever care they need. I think the unique thing about CHC is that our care is really holistic and comprehensive. So we strive to provide medical, dental, behavioral health care at all of our sites, but we also work really hard to include other services that give patients the support they need to stay engaged in healthcare. So for some patients, that might be nutrition therapy or OB services, which are offered at our sites. For others, that might be accessing services through our healthcare for the homeless sites at one of our shelters. We have a few in domestic violence shelters across Connecticut, and some of our emergency homeless shelters and food banks. And this is really where the Center for Key Populations comes in. So we bring together sort of the resources and the services for populations that experience significant health disparities. And we focus the research, the provider education, and those increased services on those populations. We also have a really strong medication-assisted treatment program. And again, we practice a harm reduction philosophy. So when an individual calls for assistance in dealing with a substance use issue, we do everything we can to make sure that there are no barriers for them getting treatment they need, with as few delays or barriers as possible. And that includes, having a really welcoming environment for everyone. So our real goal is just to give each patient, the individual care that they need in a really efficient manner with as few barriers as possible.
Thank you so much. That's really helpful.
Good afternoon. Thank you, Sean, for participating. I would like to ask you a couple of questions, if you don't mind.
Sure.
True Colors train individuals in the community, schools, organization, and others on how to support and meet the needs of LGBT youth. What does that training looks like?
So our training program, is pretty comprehensive in terms of we provide individualized requests for trainings to organizations, schools, nonprofits, companies throughout Connecticut. We've also gone throughout New England as well. So we really focus on looking at the intersections of the population. We provide, some direct case studies. We provide a lot of education. We use we're starting to go into and provide services and trainings through Zoom and online, and we're looking at creating some webinars as well. So I think that the biggest thing is getting people to look at and understand gender and sexuality for people now in our current world. And so that's really important. That's a big part of what we do. We work very closely with training DCF social workers, as well as foster care parents, as well as educators, school social workers. So anyone that works with youth and adolescents and adults in the LGBT community, and that serves them in some capacity, we work with as well to help them help the community.
Thank you.
Thanks so much. So back to Casey, I was wondering if you could please tell us about the LGBT-focused transgender healthcare services at the Center for Key Populations.
Yeah, so at Community Health Center, we really believe that primary care is the best route for most healthcare needs. And so we've, again, through the Center for Key Population, developed systems so that when people enter care or need care, it's in a very welcome and open environment, and that it's with a primary care provider, sometimes one who already has expertise in the area of LGBT care, but sometimes it's someone who doesn't necessarily have a lot of expertise, but works with one of our providers on staff who do. And so we do everything from hormone therapy to, working if someone has an endocrinologist and wants to work with us as a primary care provider. But again, we try to really tailor it to the individual needs of each patient and, provide that care and our main goal is to engage patients in care, because once we can get them into healthcare and we can provide the support services needed, we can usually retain patients in care and they can have a really great quality of life. So that's our main goal.
That's great, thank you.
Shane, can you tell us about barriers that exist with youth accessing services? What is your organization doing to eliminate those barriers?
So I think that with our direct services and what we do, or how we help youth and adolescents in general, is that we really look at trying to reduce as much barriers as we can. Some of the barriers that come up for a lot of our young folks is that their family situation, their family background, the intersections of their identity may not allow them to fully be themselves. So if there is an issue with their parents, like not supporting them or not understanding, or if they don't have support, we help them get support, whether it's through their natural support systems, whether it's at school. Sometimes, having access to resources, so access to some of the services that we have. We are providing virtual support groups weekly right now, and we're going to continue to do that. I think it was spawned by the COVID-19 pandemic, but it's really been resourceful, because there's kids and young people that have not been able to get to Hartford, for example, or to get to a meeting or to get to an event. So being able to come to be a part of it at home has been really great. And there's been kids that haven't been out at home that have used the chat feature in Zoom to really talk and get feedback about, I don't know how to come out to my parents, or I'm afraid I'm going to lose my home, or I'm going to lose my support. So they've been able to talk to people without putting themselves at risk. So, and there's also, I think, barriers related to geographic location. So there's parts of Connecticut that are very suburban and very separate from other parts of Connecticut. So sometimes I think we really look at, like, how do we get these young folks connected to other teens or other people in their community. So, if you think about Litchfield County and the Northeast corner, some of those areas don't have a lot of resources. So we do our best to collaborate with other agencies and other entities to get these kids support. And our staff is super flexible. So we travel and go out to schools across the state. We do whatever we can to make sure that we get the schools, the kids, the families, the resources they need.
Thank you.
Thanks. So back to Casey, basically the same question, but we do know obviously that the Center for Key Populations supports individuals who have experience barriers to care. So we were just wondering from your end, from your organization, how are you guys responding to those barriers? And, how do you deal with that?
Yeah, I mean, I think that we all probably know what some of those barriers are that patients who identify as LGBTQ tend to experience higher rates of things like psychiatric disorders and victimization and substance use and suicide. And so I think we really try hard to, provide screenings and do things that will identify those issues right up front and to be able to provide the wraparound support that we can to patients. Also, a big one I think is, and a lot of the research has told us that there isn't a lot of education in medical schools and even in nursing schools. And so we need to make sure that our providers are getting ongoing training to make sure that they're equipped to deal with everything involved in the care of all of our patients, but specifically the LGBT community who has been, historically victimized and discriminated against and are now coming, and we want that chance to, engage them in a really effective way. So.
Thank you. Yeah, that's a great point about the schooling. So thank you.
Shane, LGBTQ youth are 120 more likely to experience homelessness. Can you tell us why that number might be so high and what your organization is doing to level that field?
Yeah, absolutely. So so it is more likely that an LGBT youth might be homeless. And a lot of that has to do with that there are still a lot of kids that are born into environments and that don't necessarily agree or support someone who is part of the LGBT community. So oftentimes if a young person, especially a person of color, comes into conflict or that their parents or family members or guardians don't support who they are or they're not comfortable with it, in terms of, sometimes that has to do with cultural differences, sometimes that has to do with spirituality communities, so those two things are often come up, and it creates a challenge, especially for adolescents, because typically a lot of adolescents fall into this age where there's not a lot of resources. So you might have a 15, 16, 17-year-old that is kind of near adulthood, but not quite an adult. And so, they might still be in high school and they don't really have anywhere to go. So oftentimes they might couch surf, or they might, be living outside or be living in their car. So one of the things that I really love and admire about True Colors is that if we don't have the resources, if we don't have what we need to support a young person who might be homeless, we will find the services to do so. So we are connected with the city of Hartford. We're connected with our local resources, our local shelters, and so we will utilize the community supports to make sure that that those youth get the services they need. So a large part of it again is because of the fact that they're often adolescents who are rejected from their families, who don't have supports, who don't have financial means, and oftentimes it's a majority of homeless youth are somewhere within the realm of the LGBT community. I think it's 40 to 60% usually. And so a lot of kids end up going to cities like New York City, because there's more services and there's a lot of homeless youth that are there.
Thank you for the information.
Thank you.
Thank you. So yeah, back to Casey. I was wondering if you could tell us a little bit about the healthcare for homeless program and the partnerships that you guys have with homeless shelters.
Yeah, so we have 8 sites across Connecticut and a few more probably coming on board in the next couple months. And we were lucky enough that we could sort of seamlessly move to telehealth when COVID happened. So we were able to remain engaged with all of our patients. But, again, we have a philosophy of, trying to go where patients are and where the need is. And so, eliminating the need for someone to come into one of our fixed sites, having them We have state-of-the-art exam rooms in shelters and one in Prudence Crandall. We have one at Masters Manna, which is kind of a food bank and clothing bank. And so we try to really, when a community comes to us and says there's a need there, we try to respond by providing services. And it's great because it's a primary care provider and a team with a nurse. And so we do vaccinations and we have behavioral health and substance use. All of our primary care providers are able to provide HIV care and treatment treatment for Hep C. So the patient is really, again, has that comprehensive care that they need, but they get it where they're comfortable and where they feel safe. And so it eliminates another level of barrier that could potentially keep them from getting care. And so, the other thing about when we really feel like when you can connect someone to healthcare, you can also create all those other connections. So with social service supports, with resources in the community, and that's a really important part of that Healthcare for the Homeless program.
Great, thank you.
Back to you, Shane. We know that LGBT individuals experience DV at an equal or even higher rate compared to their heterosexual counterparts. They can experience all the same type of abuse with the addition of a partner outing them as a means of control. We know that the stigma around DV can be polarizing. People may not want to ask for help. Shane, if a young person is experiencing this, what advice would you have for them?
Yeah, thank you. Great question. So I think that, well, first, there absolutely is a higher rate of domestic violence that usually isn't known about or isn't discussed a lot. So there's a lack of understanding, I think, even within the LGBT community about what domestic violence is and what it looks like and the forms of domestic violence. So I think I would really start with like helping that young person understand that, that domestic violence doesn't just look like physical abuse, or it doesn't just look like control. There's other ways that this happens, and that it's a thing that has nothing to do with blame or guilt or or something that is tied to how that person feels in that relationship. But I think it's also important to recognize that their own acceptance of themselves is important in this process, and understanding that, there are options and there is support out there if that person is outed, but it's really about like providing them that safe space to talk about it and to recognize and to help them understand the severity of the situation, and that, that there is hope if they do want to come out. And I think linking that, finding some resources and some support, some peer support is also very important. But like I said, I think education is really important. I think normalizing and helping them understand that a lot of couples, a lot of people in the LGBT community experience this, and it's a lot harder because it's not talked about, and it's harder to find resources specifically for same-sex couples. And I think for men as well, it's difficult because it's my experience is that it's seen as weakness as a man to seek help if you're being abused by another person, right? So we don't want to really admit that as men. So I think that is also very important to recognize and what's the role of gender in this situation, and what are the specifics for that person. So if they're transgender, that their gender identity and that being coming up with any police interaction and any sort of legal stuff is also, and even placement, if they need a placement, is an issue that they have to, that they're going to need support with.
Thank you for that. And you have brought up a good point, education. Educating is also a good point that you brought up. So thank you for that.
Thank you.
Thanks. So Casey, LGBTQ individuals face health disparities linked to societal stigmas, discrimination, and they struggle with acceptance from family and society, which we know affects mental health and personal safety. So I was hoping you could give us a little bit more information about the mental health supports offered by the Center for Key Populations.
Yeah, I think that's a really important one. And, you know, I think the main goal for CHC in general is to provide a safe place for individuals to get care. And one of the things, as I mentioned in the beginning, that we do is really provide a lot of screenings. And so we do a SOGI screening, a sexual orientation and gender identity screening, so that we're calling people by the appropriate names and using the appropriate pronouns. That also can give us some indication of, you know, enhanced screenings that we should do. We want to make sure everybody gets what we call like a mental health screening and a intimate partner violence screening. And what that does is it allows us to, you know, allocate those resources. So if someone screens that they may be having an issue, we can immediately get them into care. For behavioral health, I think it's particularly important that there's no delay. So our services are all together. And so when someone experiences a need for that, we can do what we call a warm handoff, which is a medical provider directly links them to a behavioral health provider for some kind of assessment. And, you know, again, once you make those connections, then you can work within that system, and we can find other things. And as Shane said, which I think is really important, is to look at all those social determinants of health that are so important, especially to this community. And so to look at, you know, is there housing insecurity? Is there food insecurity? Are there other things that are creating, you know, challenges for each patient? And to make sure that we get the time and the ability to assess their needs and to direct them accordingly is really important.
Thank you. Yeah, I think that's especially important nowadays with all of this going on. So thank you.
And this question goes to you. What do you think providers should keep in mind when providing services to youth?
So I think that it's really important to look at, like Casey had said, to look at what those needs are, what their struggles are. So providing that sort of wraparound holistic approach of the dimensions of wellness, right? So it's hard to be in a good place with your identity when you don't have stable housing, or you don't have income, or you need employment. So I think the biggest thing is to help those young folks like really accept themselves, and to give them that space to like really normalize that there's not something wrong with them, that there's nothing that they did to make them this way, you know, the way that they are. To help, a lot of times I think the use of the family is also very important. So if the parents have a lot of like bias or misperceptions or a lot of struggles with accepting the young person, I think, you know, getting them to some services or helping, you know, the parents just with their level of acceptance and openness is also super important as a provider, as a social worker, and as, you know, as someone working for True Colors. It's really important to make sure that, you know, the family piece is huge in that. You know, you can't always get somewhere with a young person if their family's not supporting them. So I think it's also validating, normalizing is really important. Using affirmative language, and also what Casey was saying, it's important to make sure that you're really allowing that person in front of you to feel heard and seen. And so and regardless of your own comfort level with who they are, it's making sure that you're using the right pronouns, and that you're using the name that they use, that they identify with. And that's super important. And so a lot of times in our society, we might not necessarily feel comfortable with using someone's name and their identified pronouns. And so doing that really does allow that person to be more open with you. So it's super important to meet them where they're at, to help them get the resources they need if you don't have them, if you can't provide them. And so I think, you know, linking them to services to other peers is super important. And if it's a young trans person that needs, that their teacher keeps calling them the wrong name or won't use their pronouns, then you can help really like figure out how to do that, you know, and some of the therapists in Connecticut have gone to schools and have talked to principals, and, you know, and I've done trainings in schools, and I said, no, you can't say this and you can't say that. And so it's important to really be that advocate as well, because one positive adult in LGBT youth, a life can literally save their life. So the suicide rate is pretty high among the LGBT community, especially for youth. So just being that like positive person for them will make a huge difference.
Thank you.
Thank you. Thank you, Shane. That was really helpful. And Casey, basically the same question. We were just curious for any providers, advocates, or anyone else that's watching, what should they be keeping in mind as they provide services to individuals in the LGBTQ community?
Yeah, I think we always try to practice the philosophy that we're all human and we make mistakes and we do the best we can. And so we provide a lot of training and a lot of, you know, one of the things that we've done is role playing, because and it's not just with the LGBTQ community. Sometimes it's based on race or other things that, you know, our language isn't always effective in communicating openness. And so we want to be really careful that we're constantly having these conversations about how we can make individuals feel heard, how we can make people feel safe and comfortable. You know, one of the conversations we have a lot, especially in the Center for Key Populations, where we have a diverse community of patients, is how to say we're sorry when we don't necessarily use the correct terms, or when someone, you know, doesn't feel completely comfortable, and how to learn from that. And so we call it cultural humility, but it's really just our ability to continue learning from other people and to accept criticism as a form of changing and really shifting our focus and transforming so that we are an open and positive environment for our patients. And that's what I tell my kids. That's what I tell, you know, my family. And that's what I try to practice. And I think at CHC, we've made it really important that our providers, our staff, everybody really tries to practice that, so that we're good role models for our patients, for our communities, and for each other, you know, so we can hold each other accountable for that.
Thank you. Yeah, that's helpful and very comforting. Thank you.
Shane, this question goes to you. Although there is a limited data around transgender and non-binary individuals experience violence and discrimination, we know that this is happening at an alarming rate. How is the transgender youth experiencing difference?
So I think it's really challenging to be a transgender or non-binary youth, and especially I think when we consider adolescent development and child development, and how difficult, you know, the high school period of our life is, right? If you think about that, middle school is really hard for, I think, all of us, right? So I would not go back to high school under any circumstances. So you're dealing with the normal stuff, right? And then on top of that, you're feeling like you don't know who you are and things aren't matching up and it doesn't make sense to you. So it's even harder to regulate your emotions as a young person and to figure out who you are and to know, you know, kind of what to wear, what you feel comfortable in. And so I think that's really hard. And I think that we still as a culture, don't always value kids and adolescents and our youth as being the experts at their own lives. So we often will say, and I hear this a lot from adults, oh, you don't know who you are. How do you know that? You're just confused and you're just a kid. And kids know who they are, who they're attracted to, if they're in the right body, as young as age 4 or 5. So that's what the research shows now. So I think it's super important that we pay attention to that, because we don't often do it. So, you know, we question people and we say oh, you're just confused, and maybe you're just tomboy, and, you know, maybe you're just going through a phase. But that makes it really hard, because there's all this stuff that young person has to go through just to feel validated, just to be believed, frankly, that they are who they are, right? So it's even more difficult. And there is a lot of data. There's a lack of data and research, because oftentimes we don't ask those questions, and people are afraid to be a part of research studies. And, I think even with the census reporting, there's a lack of information, that is about the LGBT community. And so people that are often afraid to write down information or give people information. So I think that is really difficult to track. And I think everyone's experience is different in terms of coming out as LGBTQ. So when you're trying to navigate identity and you're still trying to navigate puberty at the same time, it gets pretty hard. So I think that's the challenge for our young folks.
Thank you, Shane. Thank you, Shane.
No problem. Thank you.
Thanks. So back to Casey, I'd appreciate, we were just wondering if you could help us better understand what the Center for Key Populations offers that's specific to transgender individuals.
Yeah, so much as Shane talked about, there's a real lack of resources for transgender individuals. And so, we provide primary care, obviously, with all of the screenings I talked about, but we also can provide specialty care for transgender individuals. We're really trying to, in the next few months, enhance those services so that we can provide even more care, because I think it's a desperate need, especially in Connecticut. But in the meantime, we're making connections all over the place. We work a lot with True Colors and other organizations, and just making sure that there's a system in place. In a lot of our homeless shelters, our sites, we find youth who identify as transgender and are homeless or at risk of homelessness or couch surfing, and so making sure that we provide the appropriate support there. And then Shane mentioned something really critical, which is family support. And I think not being dismissive of families who initially have maybe not the most positive reaction, but instead knowing that, especially for youth, but even for adults, it's really important that their families find some kind of acceptance. And it may not be the perfect world that they want, but we can help with that with behavioral health groups and support groups. We have some really great peer support groups. And so I always try to really encourage not dismissing anyone as, there are times when that's necessary, but looking for those solutions in that way that you can embrace things and bring people into the fold rather than, exclude them. And so that's really what we try to do. And again, just base it on individuality. And, we also have school-based health centers across the state where we have providers who are doing phenomenal work with really working on risk reduction, for everything from HIV and Hep C and STIs to, suicide prevention and overdose prevention and things like that. So making sure that there's a safety net for transgender patients.
Thank you. Yeah, and thank you for mentioning the school-based health centers. That's really important. So thank you.
Back to you, Shane. When exploring your website, I saw something about a mentoring program. Tell us about that and how one could get involved if they were interested.
Right. So, our mentoring program is actually a critical part of our Safe Harbor project, which is our direct relationship with DCF. We work collaboratively with DCF, and we've been doing this for a number of years to make sure that any LGBTQ adolescents or youth that are placed in out-of-home care are given the best resources possible. So typically what happens is, especially with adolescents, they end up in group homes or congregate care settings because it's harder to place kids out of home in general, especially as closer to age 18 as they get. And what happens is that we really make sure and help DCF with making sure that the foster care placements are, affirming and queer competent and really just really a suitable place for these young folks to be. And with that, the mentoring program pairs these individuals, these young folks, with successful LGBT adults to give them the opportunity to have a positive relationship with someone in the community. So they provide services, and they meet with, or right now they're doing it virtually mostly, but they do social activities. They do just really fun and meaningful stuff with these young folks. So currently it's a referral-based program that works directly with these youth in TCF custody. But it's super important because there's about 100 kids right now in the state of Connecticut that are in this program, and they really need those positive supports. So I just want to mention too that like a couple of things that we do as well. So we have a GSA program, so we work with the Gender and Sexuality Alliances in the high school and middle schools throughout the state and provide training and implementation and retaining those programs. We also have the largest LGBTQ conference in the country. So we have about 5,000 to 6,000 people that come to UConn every year. And there's kids from all over that get so much out of this. And that's one of the main things we're known for. And thank you, Liza. There's a link for our services as well that's sent through the chat. So there's a lot of different aspects of what we do that are important. So we do a lot of advocacy work and training, as I talked about earlier. So yeah, thank you.
Thanks so much. That's really interesting. So Casey, back to you. I was hoping that you could tell us a little bit more about the HIV PrEP and PEP programs.
Sure. So this is like, I always tell my people, it's like a miracle because PrEP is pre-exposure prophylaxis and PEP is post-exposure prophylaxis. And it's really amazing. It's a single HIV drug that you take once a day. And when you're adherent to it, it can be 99% effective in stopping the transmission of HIV related to sex, and about 76% effective with injection drug use. And so really this is just amazing. And unfortunately not getting as much uptake as we had hoped. And so, when we look at communities like Black men who are having sex with men who are the highest rate of HIV infection by far, but just really having trouble engaging them in PrEP. And there's some obvious reasons of, it's an HIV drug, it's the discrimination or the stigma around coming and asking for it. And so at CHC, we're always looking for innovative ways to make that available to people and let them access it without too many barriers like that create that stigma. So looking at, can we put someone on PrEP over the phone? Can we try to eliminate some of those things that make it a really hard conversation while still providing the education and the critical clinical care that they need? With PEP, it's a little bit different. So PrEP, you take one pill every day. Our primary care providers all can give you access to it. With PEP, you have to do it within 72 hours of the exposure to HIV, and it's a 28-day cycle usually. And again, very effective if you take it every day, but adherence tends to be a little bit of a problem. I think some of the stigma around PrEP and PEP is that HIV drugs, if you're old like me, you would have heard how the side effects were awful, and there was, and that really isn't the reality anymore. Very few people have side effects from PrEP and PEP. And so a lot of it is just education and getting that message out to the public and to our patients. And then internally, we also look at, do we have patients who are at high risk that we can proactively reach out to and ask them if they're interested and explain the benefits for them. And so an overall, health goal for us is to get more people on PrEP who have high risk behaviors, and to do it in a way that's easy and efficient for them.
Wow, that's really helpful. Thank you.
Hi, Shane, this question is for you. If I were a young person who needed support and wanted to reach out to True Colors, how would I do that, Shane?
So you can call True Colors. There's a ton of information on our website. We have a online resource guide that has connections to information, therapists, support programs, programs for adults, like anything you can really need. Community health centers, doctors, physicians that are LGBTQ affirming, everything is in there. You can also email us. You can contact any of the staff directly. We're on Instagram, Facebook, pretty much we're everywhere. So we're pretty easy to get access to. We also, Robin and the staff and even the board of directors are really accessible and available. So any way that a youth could reach out, and even providers have contact us and look and are looking for resources. So yeah, we're always available.
Thank you, Shane, for providing that information.
Thank you.
Yeah, thank you. And actually, I think it's the final question. So Casey, I was wondering if there is someone out there who is in need or looking for a mental health support, they need a doctor, or they maybe want to try PrEP, how easy would it be for them to contact the Center for Key Populations and get help with that?
Yeah, it's really easy to contact CHC, www.chc1.com, and that gives all of the information. We also have the Center for Key Populations.com, has a lot of extra education and things like that. It also has some assessments and screenings that you can do to see if it's something you're interested in, something like a PrEP, or if you want more information on substance use services. And we have a lot of really qualified individuals who will call back. There's an email address that is just anonymous if you have questions you want to ask us, or so it's really easy to contact us. And again, just like Shane, we have a lot of resources outside of CHC that we can also provide to make sure that that we have great community partners, so we can make those connections as well when needed.
Great, thank you so much. And I thank both of you for coming on. We really appreciate all the great resources, especially for both youth and adults. And we know this is obviously a really important resource for victims and survivors. So we really appreciate your time. Thank you.
No problem, thank you.
Thank you for having us, this was great.
Yeah, definitely.
Yeah, thanks very much for joining us. Robin, it doesn't look like there were any questions. All right. So again, Shane and Casey, thank you very much for joining us today. I always do like to close out just with some contact information for Safe Connect. So again, Safe Connect is Connecticut's domestic violence resource hub. If you are a victim, and domestic violence certainly knows no boundaries, which Shane and Casey definitely touched on today. Please reach out. We have all these services available that you can access through Safe Connect. You can call or text 888-774-2900 or go to ctsafeconnect.org to chat or email with an advocate. Our advocates are available 24/7, and bilingual services are available, and all services are confidential, safe, free, and voluntary. These are our 18 member organizations across the state. They will provide that continued, ongoing, localized support. And again, today, if you have any, oh, sorry, Wanda, looks like I spelled your name wrong there. If you have any questions about today's presentation, you can reach out to Wanda Gaines, who again is our Director of Diversity and Accessibility, at wgaines@ctcadv.org. So again, thanks everyone for joining us today. Please do tune in next week, 2 o'clock on Wednesday, July 1st, when we'll be joined by the Judicial Branch Office of Victim Services and the Domestic Violence Crisis Center for a discussion about victim compensation. So thanks everyone. Enjoy your day. Bye.